Hi, this is Joe Barton, and I'm with Dr. Scott Saunders with the Integrative Medicine Center of Santa Barbara. And we wanted to talk to you a little bit about our high blood pressure report. So Dr. Saunders, let's talk about hypertension. What are the symptoms of hypertension?
Well, that's one of the problems with hypertension is that very often there aren't any symptoms. People sometimes say, I can feel my blood pressure going up, but most of the time it's not the blood pressure, but the heart rate or from adrenaline or something like that, which does make the blood pressure go up. Hypertension has no symptoms, and that's one of the problems, that it doesn't have any symptoms.
It's called the silent killer.
Yeah. Well, it's not a silent killer. That's a lie.
Yeah? Why is that a lie?
Because blood pressure it's not hypertension that kills. It's whatever's causing your blood pressure to be high is also creating a problem in your body in other ways, for example, heart disease. But it's not the blood pressure. The blood pressure is just a marker for it, really.
So is it important to treat high blood pressure, or how do you explain that?
It's important, if you have high blood pressure, it's important to know that your blood pressure is high and then find out why it's high and bring it down, yes.
Mm-hmm. Most people, when they have hypertension or high blood pressure, they'll go see their doctor, they'll have their blood pressure checked. Oftentimes it's elevated because of what they call white coat high blood pressure, just because they're more stressed from being at the doctor's office. But in traditional medicine, what do most doctors do if somebody has high blood pressure? What's the treatment, standard treatment?
Well, they're given medications. Oh, I see your blood pressure's high. Here, take this pill. And ideally, that's supposed to bring the blood pressure down.
What are some problems with that way of treating it?
Well, one of the biggest problems is you're not necessarily treating the cause, why the blood pressure is high. So if you have a metabolic syndrome, for example, and you bring the blood pressure down, you still have a metabolic syndrome. You haven't improved the condition, because you're still going to get heart disease. You're still going to have an increased risk of stroke in spite of bringing your blood pressure down.
So what are the root causes of high blood pressure?
Blood pressure always goes up when the blood vessels constrict. So anything that will constrict blood vessels is going to cause blood pressure to go high. So inflammation, hormonal abnormalities like too much cortisol, too much adrenaline, those kinds of things, neuropathies of various kinds, and then kidney disease can cause the blood vessels to constrict and push the blood pressure up. Okay,
so most of those causes can be remedied through, well, you'll find out in here, but diet changes and some other things. Talk about some of the natural remedies and treatments that you recommend.
Well, specific remedies might be something like magnesium or potassium, both of which are kind of low in the diet in the United States especially. So sometimes just adding in potassium does it. In fact, one study showed that drinking a can of V8 juice, which is a vegetable juice, was as good as taking a blood pressure medication.
So is measuring your high blood pressure or your blood pressure after you've been treating it with natural remedies, is that a good indicator, or do you have to look beyond that?
Well, knowing your blood pressure is helpful, because that's how you know, that's the vital sign. That's how you know that it's working, that what you're doing is working.
Mm-hmm. So you told me that you get some phone calls frequently from people that have come across our websites, and they want to know, Dr. Saunders, is this report something that I should get? What do you tell people?
It's kind of interesting. Most of the time they ask, okay, I just wanted to make sure that you were a real doctor, that this wasn't a scam of some kind. And then they ask, well, should I buy the report? And I tell them, well, if you were to make an appointment with me to come in and see me, you'd pay $200 and I would tell you this. And so why not just do this first, and if it works, then you don't need to come and see the doctor. And if it doesn't work, then you may need to make an appointment and find out why.
Mm-hmm. Well, thank you very much for your time, and thank you for visiting here, and I hope that you will be curious enough to find out what is inside here so you can take better control of your own health.